Did you announce a PCO for today or any just like gynec problems?
PCOS that we have mentioned.
Okay.
Yes, ma'am, you can start.
Good afternoon, everybody. I'm Dr. Jayashree, gynecologist in Ankura Hospitals. I'm a senior consultant. Today we'll be talking about polycystic ovary, that is commonly known as PCO and also PCOS. Okay, there's a small difference between PCO and PCOS. PCO means it's a polycystic ovary. How do you say it is a polycystic ovary? It is appearance of the ovary, which we see while doing a ultrasound scan. So by looking at the scan, the ovary is named as polycystic ovary. When there are other associated signs and symptoms with that and other problems, it is called polycystic ovarian syndrome. Basically, polycystic ovary is a hormonal condition depicting hormonal imbalance in women from all ages, starting from adolescents, reproductive age group, near perimenopausal age. Anytime we can find this type of ovary. Polycystic ovary will have lot of small follicles which are seen in the ovary, numbering more than, when the number is more than 12, we call it as polycystic ovary. Usually, we see this in young adolescents coming to us saying that I have a polycystic ovary. When we see polycystic ovary in adolescent age group, that is after they start periods, like at the age of 12 or 13, up to the age of 16, there is a hormonal, complete hormonal balance will be going on in the body. That is, the female hormones are controlled right from the hypothalamus. After that, there is another gland called pituitary and then ovary. So this hypothalamus, pituitary and ovary, this whole axis, it is called HPO axis. All these should be working in synchronization. So for our body, all the hormones which are there, they are always they are having signals from the brain. From there, they come to the target organ and they act. So the signals coming from the brain will be acting on the ovary to make it an organ which will be working in synchrony, so that the periods will start and they will be going on a cyclical manner. In polycystic ovary, what happens? There is a imbalance. I said the major female hormones which are important are estrogen and progesterone. In polycystic ovary, what happens? There is also a male hormone. In all women, there is also male hormone which ultimately converts into estrogens. But in polycystic ovary, there is a dominance of the male hormone. That's why sometimes in polycystic ovary, we find the girls coming with unwanted hair growth on the lips, on the chin, increased body hair, like this. This condition is called hyperandrogenism. That means excessive male hormone effect. So that is one of the characteristics of this polycystic ovary. Appearance of the ovary and also the male hormone tendency showing excessive hair growth and irregular periods. There may be delayed periods. Usually the periods in a normal cycle the cycle should be once in 28 days to 35 days. In polycystic ovaries, there may be delayed periods. Sometimes they don't get periods for 45 days, 2 months, 3 months. Sometimes they don't menstruate. I'm sorry, yes. This is a little about the hormonal imbalance, what is happening in the polycystic ovary. So most commonly, the patients come to us with delayed periods and irregular periods. In that cases, we always ask for a scan to see the appearance of the ovary. When we see more follicles, like more than 12 follicles in the ovary, then we say it is a polycystic ovary. And also, we also check for their hormonal imbalance. Sometimes, see, in polycystic ovary, the reason why they develop polycystic ovary, there may be many factors which can contribute to polycystic ovary. One is there may be a genetic tendency in the family. Sometimes history of diabetes in the family. And weight of the patient is also very important. Many patients with polycystic ovary are overweight or obese. This is one reason why they develop polycystic ovary, because of overweight. And there is something called insulin resistance. So you know about the insulin. Insulin is a hormone in our body which is important for sugar metabolism. In polycystic ovary, there is a tendency to develop resistance to insulin. So they don't use their sugars, that is glucose levels, properly. That is one reason why they can gain weight. When the patient gains weight, again the insulin resistance develops. So in polycystic ovary, there is also abnormal glucose metabolism, and that is called insulin resistance. So all these factors contribute to the development of irregular periods. When we see the same polycystic ovary in women who are married and who want to conceive, when they want to plan for pregnancy, this delayed period and polycystic ovary causes infertility. So many of the infertility patients, we also see this polycystic ovary because they don't develop eggs on time and eggs don't mature in time and they don't get released. So in women coming with polycystic ovary and infertility, we have to correct their hormonal imbalance and see that they get egg release properly to get conceived. So in reproductive age group, infertility is very common because of polycystic ovary. And again, as I said, and people who are perimenopausal, that is after 40 years of age, again there will be hormonal imbalance, and we can see this type of polycystic ovary in women above 40 also. So, treatment of the polycystic ovary in different age groups is different. In young girls and perimenopausal women, we try to get their periods regularized, and in women reproductive age group, we have to help them to conceive. So the treatment depends on the age and desire of the patient. So in overall, the treatment falls into two major, we can say we have to give treatment in two important ways. One is most important is lifestyle changes. As I said, many of the polycystic ovary patients are obese. So lifestyle modification, that is proper weight, maintaining proper weight according to the height. Okay, there is something called body mass index. So your height and weight have a relationship. So you have to maintain proper weight according to the height of your body. That is called body mass index. So the body mass index should be somewhere around 23, 24 is considered normal. Anything above 26 is abnormal. So try to maintain weight by taking proper diet, balanced diet, and controlling the carbohydrates, that is rice, wheat and all, which can contribute to gaining fat, gaining weight, and insulin resistance. So balanced diet is very important. Along with that, exercises. See, physical activity increases the sensitivity of your insulin in the body. So daily exercises, half an hour to 45 minutes, up to 1 hour, is very important for people suffering with this polycystic ovary. Proper diet, exercise are very important in their lifestyle. So once the problem of polycystic ovary develops, it may not go totally. There is no complete cure for polycystic ovary also. That's why maintaining lifestyle, maintaining weight throughout the life is very important. And second is medical treatment. We try to give medicines because they have hormonal imbalance. So because of that, they'll have excessive bleeding sometimes, irregular bleeding, or some people may have normal period. Some people will not have periods at all. So depending on their periods, we plan their hormonal treatment. And women who desire children, we say that they develop proper egg formation, egg maturity and egg release, and try to help them to get pregnancy. Again, women of 40 years and above, we try to regularize their periods. One important factor which happens because of this hormonal imbalance is the future problems because of polycystic ovary. See, polycystic ovary is not a treatment which can be finished in a day or two or 6 months or 1 year. As I said, there is no permanent cure. So throughout your life, you should be aware of this problem, and we should always try to prevent. There's something called long-time complications which a patient can develop because of polycystic ovary. This is, they can develop diabetes, they can develop high blood pressure, and they can develop because of excessive hormonal activity. They can develop changes in their uterus. So the uterus lining is called endometrium. So this lining grows because of estrogen hormones. In polycystic ovary, there is dominance of estrogen. That's why they develop very thick endometrium. The uterus lining becomes very thick. That's why they have prolonged bleeding, long time bleeding, 15, 20 days or continuous bleeding. What happens in them? Their uterine lining becomes too thick. Usually it should not cross 12 millimeters. In these patients with the polycystic ovary, sometimes we find endometrium more than 12 millimeters, 16 millimeters, 18 millimeters, which is very abnormal. This overgrowth of endometrium is also called hyperplasia. When we find endometrial hyperplasia, we take a sample of the tissue for biopsy and test what type of cells they have. Sometimes because of long exposure to estrogen over a period of time, these endometrial hyperplasias can develop abnormal cells which can become in future cancer cells also. That is one of the complications of polycystic ovary. So patients of polycystic ovary in their older age can develop cancer of the endometrium, that is cancer of the uterus also. So these long-time complications of the polycystic ovary is also very important. That is why once we know that there is a problem in young girls, that is the time we should start controlling the ill effects of polycystic ovary so that they will not have future complications like diabetes, hypertension, endometrial malignancy. So one part of the treatment is treat the present condition and also prevent future complications. And many of our patients, usually they come, young patients with their mothers already saying that we have PCOS. How do they say that they have PCOS? Because most of the time when they have irregular periods, they go for ultrasound scan and they come back with the report saying they have polycystic ovary. And they will be worried about that. So whenever you get a report in young age group, especially polycystic ovary, please don't get worried because that type of ovary is common in that age group because of the hormonal imbalance. When we see polycystic ovary, we try to make them understand the importance of hormonal balance and maintaining their lifestyle. Okay. And also the women of reproductive age group, they also come with polycystic ovary, delayed periods, irregular periods, not conceiving. So when you have this type of polycystic ovary in women who desire pregnancy, please contact your gynecologist and take proper advice. Change your lifestyle, try to lose weight, see if you can maintaining by proper lifestyle, you may get proper periods, or if you are overweight or obese, you should take proper advice. In polycystic ovary, correcting the hormonal imbalance, correcting the weight, and also helping the reproductive age group patients conceiving, everything is a challenge. So trying for pregnancy, sometimes polycystic ovary people will not respond easily. They may need further treatment. Sometimes they may need small surgery on their ovaries, where we can change the hormone problem by making small drills in the ovary. It is called, some people, they already know. This is, we want to go for laparoscopic surgery for polycystic ovary. It is not for everybody. We try with medicines. If they don't conceive, we also try the surgery. Like this, there is multiple factors associated with development of polycystic ovary, and treatment is also, it is oriented towards the patient. Every patient we have to see what type of problem they have and treat them accordingly. All polycystic ovary patients will not have same problems, and same treatment is not applicable for every patient. So we have to individualize the patient, individualize their treatment. We have to investigate the patient. Every patient has to be investigated and then come to a decision what is their actual problem, and then treat polycystic ovary. So this is a little about the polycystic ovary. I hope you all understood little bit about this problem. And whenever there is a problem, please contact your gynecologist for guidance. Thank you for patient listening. 20 minutes.
Thank you, ma'am.
It must have come for 20 minutes.
Yes, ma'am. Thank you.